All right. Hi, everyone, and welcome to our Investing in a Public Health Education live event. We really appreciate you taking the time to come hear about the very important and timely field of public health. So first, I will introduce myself and give an overview of our public health program. And then as the moderator for the event, I'll also introduce our key speakers, who are Dr. Han Kim and also our current students, Anisa and Asma Dahir. So I'm Colette McAfee, and I'm the director of the undergraduate public health program at Westminster College, and I'm also a core faculty member within public health. I teach several classes in our undergraduate program and also several in our graduate MPH program. And when it comes to my background is in the social and behavioral side of public health, which is one major discipline within the field of public health. Really just trying to understand and explain why people do what they do, essentially, and why people engage or not engage in certain health practices. In this branch of public health, we focus a lot on exploring social factors that interact with health outcomes, including things like education, income, gender, sexual orientation, race, religion, and many other factors that interact with health and health behaviors. But just to talk about our program overall, public health is really about promoting health and wellness, preventing disease and illness, and also protecting populations. And it's very interdisciplinary, which is one of the things that I personally love about public health is how it relates so well to so many other fields. So some fields that it relates really well to would be the fields of medicine, psychology, sociology, economics, environmental studies, biology, and many other fields. So there's many options for you that are available, or for any individual who is seeking out a career in public health. There's lots of different career paths that you can go down. In terms of the public health program at Westminster, we do have expertise in coursework in many different areas of public health, including the field I just mentioned, the social and behavioral sciences, but also areas like global health, epidemiology, biostatistics, health policy, chronic disease, infectious diseases, and several other areas. So there's lots of different arenas that you can explore. We do tend to be a pretty sought out major or minor for many students at the college. And we do have many students who focus on public health as their sole major. And some students also can pursue the route of having a double major or a customized major with public health in it, a minor with a public health major, or you can also have a minor in public health and then have another major of your interest. Many of our students also have public health as their major, but also are pursuing the pre-professional track, meaning that they intend to go into a professional degree such as a medical doctor program or med school, physician assistant program, nursing programs, and a variety of other professional degrees that relate to public health. In our program, we have 4 core full-time faculty, including myself and our next speaker, Dr. Han Kim. And we also have several core adjunct professors who teach in the program. Due to the nature of Westminster and our program, we really do have close contact with all of the professors, and we are very accessible to help with things like advising, mentorship, research opportunities and collaborations, and also asking questions about classes, public health content, etc. So you not only get to know your professors very well, but you also get to know your classmates very well too. Our class sizes are small, typically 15 to 25 people, depending on, I would say 10 to 25 people, depending on the class, and tend to be very interactive. We have lots of meaningful discussions on relevant public health content, current events, and all sorts of things. Throughout the program and after graduation, there are also many opportunities to go right into the field and get public health experience. In our program, you can get an internship in public health and actually have that apply to credits in the program. For example, many of our current students or even recently graduated students have had experience conducting contact tracing with COVID, meaning that they trace individuals who have been potentially exposed to COVID, which is a very important task for infectious disease outbreaks and epidemics to try and curb the spread of disease. And there's lots of other internship opportunities and experiences that you can get while in the program and after graduation. And we actually have a really great track record in seeing our graduating public health students go into even higher levels of education. Many of our students have gone to med school, physician assistant programs, again, nursing programs, and a lot of other health-related fields after they graduate. And many of our students also pursue a higher degree in public health, whether that be more of the academic route or more of a practicing professional in public health by getting a master's degree in public health. And we've also had some students go on and get a PhD or a DRPH, which is a doctorate in public health. So that's just kind of a broad overview of our program and some opportunities that are available to you when going through the program and after graduation. So now I'm going to transition into Dr. Han Kim's section. Dr. Kim, like I mentioned, is also a core faculty in our public health program, and his expertise is in epidemiology and biostatistics. And he's a very passionate, dedicated, and knowledgeable public health professor. So we're going to hear about his experience and interaction with students. And then we'll have our two current students, Anisa and Asma Dahir, who are, again, some of our excellent current public health students, talk about their experiences in the program. So I'm going to turn it over to you, Dr. Kim.
Thanks, Colette. So hi, name's Han Kim. I am an epidemiologist. I'm one of the faculty at the college in public health, one of the 4 faculty members. I also teach in the honors college. I can talk a little bit about that and the intersection of honors and other disciplines in public health. But a little bit about me. I've been at Westminster for 12 years or so, I think. Before then, I was at the U, so I've kind of been at this big, large institution and also a small liberal arts college like Westminster. So I think I can, comment on the differences between those two really kind of different learning environments. But a little bit about myself. So I'm originally from Boston. I'm on the East Coaster. Kind of lived all over the place. Public health was not my original career. I was an engineer for a few years before I changed careers midway. There's a long story there, and if you come over to Westminster, I'll tell that story to you sometime. It's a long story. It's kind of a fun story. But anyways, I ended up in public health midlife. Learned about epidemiology. Didn't know what that was until I started public health, but it's something that I'm really passionate about. Got my PhD in at University of Washington, Seattle, and then when Utah came calling back, I just couldn't say no to the powder, so I moved out here. So that's a little bit about me. So my passions really are epidemiology, which is kind of the basic science of public health. So it's the study of diseases in population. So for a doctor at a hospital or a clinic, their patient is going to be the individual, and they learn physiology and genetics and biochemistry and cell biology to be able to treat the patient. Our patient is the community, the population. So epidemiologists learn how diseases kind of they're kind of how they're distributed, how they spread in population. So we use tools like epidemiology, biostatistics, but also sociology, anthropology, genetics, environmental studies, health education, health behavior, psychology. So like Colette said, like Dr. McAfee said, it's so multidisciplinary, and that's what I love about it. I mean, that's why we all love public health, because you quickly realize when you think about the population the health of a population, just about everything affects it. So if you're one of those students that likes to kind of look at the big picture, look at the forest from the trees, look at how all these different factors interact, public health is an amazing field. I'm not saying that, of course, nursing and medicine, those are great fields if you really want to focus on the patient. But there's an entire whole other side of healthcare, and that's in public health. So a lot of students come in and say, hey, I want to go into healthcare, but all they know about is being a doctor or nurse. Well, there's a whole other field. And you may not want to get into patient care, but you're still passionate about healthcare. Public health is really the field to be. So I think that's one of the reasons why I love public health, because how all these different pieces interact. interact with each other to affect our health. And like I said, it's just great for people who like to see the big picture. You know, I think the great example of that is COVID, how everything seems to affect COVID. It's not just about the biology, about physiology, about chemistry. It's all about, I mean, it's about sociology, anthropology, history, psychology, how we interact with each other, why we get COVID fatigue, why some folks deny the use of masks, and there's so much to it. Even, I hate to say, politics and economics come into play. So I think it's a field that's exciting because you get to see the big picture, and that's what I love about it. So the other thing I'm really passionate about is global health. So global health is something that I've been practicing and doing research in for years. One of the, I think, one of the most popular trips that we have to go abroad during what we call May term. May term is a really cool, it's something that's unique to Westminster. So May term is a short 1 month term, 1 month term during, so believe it or not, May. And we have the option of taking some really fun classes on campus. So if you really wanted to learn about you know, the philosophy of Hogwarts or the whole role of cat memes on the internet, there's awesome classes like that for you during May term. But the other part of May term is study abroad, the short-term faculty-led study abroad. And for the last 12 years, I've been taking students to Thailand for a month. And it's an amazing experience. One of the things I think one of our foundational principles at Westminster is the best way to learn is to be immersed in something. Okay, so the best way to learn about global health is to be in a global setting. You know, I could talk about it in class and it'll be interesting, but to really truly understand something, you need to go there. So it's one of the reasons why I take students, 20 some odd students, to Thailand for a month every year. And we go, and it's not just a tourist trip, we go into the rural, remote areas. We experience what life is like for Thais in the mountains along the Thai-Burmese border. We visit refugee camps and refugee clinics to understand kind of the health effects of being a refugee. We understand, we participate in public health in a developing country, which is very different than the public health here. We get to see the impacts of malaria, dengue, and some of these diseases that we don't see over here, but is endemic in Thailand. So it's a really fun trip. Unfortunately, in the last 2 years, we've had to cancel because of COVID, but hopefully we will continue this. So it's something that we're passionate about. You know, to really learn something, you really need to experience it. So whether that's going abroad or doing an internship or doing research with your professors, and because, like Dr. McAfee said, we're such a small institution, we can do that with you. You know, and what's great is you go to Thailand with me, and we get one of I think the most exciting things are just getting to know your fellow students and getting to know your professors outside of a classroom. So, you know, when we're all hot and sweaty and trying to keep the mosquitoes off us, we kind of, you know, we got to learn it's a different learning environment when we're all just kind of sitting around in a remote village, eating traditional Thai foods. It's a very different learning experience. So that's one of the things I think I love about Westminster, is that it's the relationship that we create. You know, it's not just a small classes, but all these unique experiences. I still run into students today that went to Thailand with me, and we talk about the old days, and, you know, even years after they graduate, they still remember those times. So it's a really special place, and where you get to look. Honestly, I went to University of Michigan, huge school. I don't remember any of my professors. I don't think they remember me at all. But I remember just about every student that graduated in public health. If I run into them, I'll say hi. We talk. That's what makes Westminster special. And remember, I taught at the U. It's a very different environment. The U is a great institution, but Westminster is really special because of those relationships you develop. So yeah, so that's the kind of experience that you'll get at Westminster. You're going to get a lot of professors who are really incredibly passionate, because that's what we do. That's what we do at Westminster. It's a teaching institution. We're not out there to win huge research grants or do a ton of research. Our main priority is the students, and I think that shows. That when you come here, you realize that we are really dedicated to the students here. We don't have any other competing priorities other than the students. So yeah, so that's a little bit about my passions about public health, what I do. We get involved not just in the classroom, like I said. I have all these trips, but I also do things like the last year I've been doing what's called the COVID brown bag every Friday. It's not something that I get paid to do. I do it on my own time, but I do it because I really am passionate about COVID. No, I'm not passionate about COVID. I'm passionate about public health and really trying to get the right information out there. So, by the way, anyone is welcome to join. If you all want to join in, it's every Friday at noon on Zoom. I can send you the Zoom link. I'll put my contact information at the end, and so you can contact me if you're interested in participating. This week, we're going to talk about the numbers globally, locally, nationally. We'll kind of analyze what's going on. Where's COVID really bad? Where's it getting better? And then we're going to talk about the recent news. So all the different variants, are they more transmissible? Are they more deadly? What about vaccination? How's the vaccination going? Is this vaccination campaign really that great? Hint, it's not. We can do much better. What are the new vaccines that are coming out? And then we're going to talk about a special topic. And every week I try to have a special topic. And this week we're going to talk about social justice and COVID, how people of color, communities of color have been so disproportionately affected by COVID, and discuss why that is. That's another, by the way, that's another research passion of mine is health disparities and why certain groups of folks have such poor health compared to others. So I can babble on for a long time about public health. I love it. But I want to transition to Asma and Anisa. They are two of our wonderful students in our public health program. I've known them since they were first years. Watching them grow has been so amazing, and just I've had them in honors classes and public health classes. By the way, I just mentioned the honors program, and as well as other disciplines. Public health is so interdisciplinary. I think you can just pick two majors or a minor or major in just about any field, and you'll find it relevant to public health. But honors is a wonderful way to go as well. So, and there's a lot of public health students that are also honor students as well. But I want to let Asma and Anisa talk a little bit about their experience from a student standpoint at Westminster.
Perfect. Hi, everyone. I hope you all are well. And I also want to say and congratulate you guys all for taking this next step, especially in this hard time. I know if I was a senior or a junior in high school, I wouldn't even want to think about college, especially living in a COVID world. So I just want to congratulate you guys on taking this next step, and it will be worthwhile. My name is Asma Dahir, and
I'm Anisa Dahir for twins.
Yeah, we're twins. We take every class together. We're the double duo. But we just want to talk about our experiences at Westminster, and more particularly being public health majors. So we both are majoring in public health with 2 minors. So we're both honors minors, and also we do pre-professional minors. So we're both pre-PA students. And I just want to talk about how we got into public health, and then from that, how our experiences have really molded us and who we are and what we want to go into in the future and our future aspirations and careers. So when we came to Westminster, we were both initially neuroscience majors, and we had the hopes of continuing into neuroscience and then going into med school. However, we really didn't understand college and the nature of the environment, and also we didn't know of the public health degree that is offered here. And I think going into it blindly, we really lost out, especially the first year of our college experience as freshmen, the opportunity of really enhancing our education, going straight into public health. So I'm really proud that we have this space to really talk about it with you guys before you guys come onto campus. For me personally, the reason why I transitioned into public health is because I'm more passionate about learning about the different social determinants of health, which is a really big word, but it basically goes and dives into different structures and how that influences a person's health state, and thinking about looking at housing and looking at socioeconomic statuses, education levels, and how that all of those predispose you for different diseases and things like that. So I really wanted to enhance my future abilities of when I become a clinician. Since I was saying I'm pre-PA, physician assistants, I really wanted to enhance that by really understanding different health diseases and diagnoses and how they can be prevented, especially in communities of color. And I think that we got that comprehensive education with our public health degree.
Mm-hmm. Hi guys, I'm Anisa again. And going off of what Asma said, we were one of those students, like Han described, that thought that the only way to get into the medical field was to go straight into pre-med. And we didn't know about the field of public health until we talked about it with one of our peers who graduated. Her name is Jade. She's also working as an epidemiologist now with Tooele County. But she explained to us what the field was, and it was then that we decided to switch like that because it aligned with all of our future aspirations when it came to working with communities of color and the things that they need in terms of public health. And like Asma said, we're both pre-PA, and I personally believe that if you are going into medicine, whether it be clinical medicine or public health, all aspects of things relating to health, I feel like every clinician, every person who wants to work in the health industry needs to have a public health foundation, and which is this is why we decided to go into public health, is to understand the different social determinants of health and health disparities and how different things align to either affect or support someone's health. And I feel like public health is a great way to have that foundation, and it's a great way to get into the future profession that you want to go into in the future.
Mm-hmm. We're also honors minors, so if you guys have any questions on honors or pre-professional tracks, because we were pre-med once upon a time ago, but we made the switch to pre-PA, which I think is better. And I also want to mention that like Han and Colette were saying, there's so many different avenues you could take public health into, and it's a matter of finding your passion and where you want to go with that. For both me and Anisa, like I said, we're the same person, but just two of us. We both have the same passions of going into clinical medicine and really adapting that into a public health preventative method and mindset to really enhance the health of our communities, because we're both daughters of Somali refugees. We were born and raised here. However, our family came, my mom was pregnant with me and Anisa when she came. And looking at how different diseases like diabetes and hypertension to even COVID, how Han was talking about, has affected disproportionately our communities and other communities that we align with and identify with. I think having that understanding of where that stands and how to move forward is very crucial, especially being students of color. We can now take the education that we learn and go forward and really work with our communities to really rebuild that connection that has been lost through history and things like that.
And then the last thing I want to mention is that we're both also a part of Legacy Scholars, which is a organization on campus that is fostering space for first generation and underrepresented students. And it's a program that really amplifies our voices and allows us to get the proper resources to get through college. So if you have any questions about Legacy Scholars, we're here to answer that as well.
And I think the last thing I want to mention is the endless opportunities that is on Westminster, and how the professors really know who you are and what you align with and what you want to do in the future, and they really seek out opportunities and give it to you directly. Because I was told different opportunities, even from Anisa, even though we're like the same person, but some of my professors said, oh, hey, this will fit you, and I think you should apply to this experience, and vice versa. And I think with that, we're seniors now, we graduate in May, and like for me, I got accepted into PA school at Northeastern in Boston, and I'm currently interviewing tomorrow actually at Stanford. And I think that it's really important to understand the different opportunities that were awarded to me to be in the position that I am in now. Also, like Anisa, she got a fellowship, and I'll let her talk about that.
Exactly. I was awarded the Gilman Scholarship, which is a study abroad scholarship for first generation low income students. And my hopes was to go to Thailand this year, but unfortunately, because of COVID and other situations, we weren't able to go. But I've been researching multiple study abroad programs, and there's actually so many of them out there that's tailored to public health that I've been looking into. I'm really interested in one that takes you to Kenya, and you work with the Kenyan public health leadership over there. So there's so much that the public health field can afford you. The opportunities are endless. So if you have any questions, just let us know.
Yeah, and the last thing I want to say, sorry, I keep thinking of new things, is the personal education that you get here and the mentorship. To what Anisa was saying about her fellowship, I know at larger institutions, they just stopped allowing you to go on study abroad trips, right? Like Anisa was rewarded this really amazing fellowship that provides her full tuition to her study abroad. However, she was able to work really closely with faculty to really find a placement for her, and it didn't stop at matron being counseled, you know? And so we love it here. All of our sisters went to the U. We have 4 sisters that graduated from the U, and we had a completely different experience than them. I think our experience is better. So we will give you guys our contact information, and you guys can feel free to reach us, and we can talk about whatever you guys want. Thank you.
Okay, thank you, Asma and Anisa, and thank you to Dr. Kim. That was really great information, and like they mentioned, we're here to answer questions. If you have any you'd like to ask, there are a couple of questions in the chat that we can go through. Han responded via chat, but I figured we could do them via audio as well. So for this first one, to Han, what are some optimistic things that public health professionals or students have learned about COVID, and what the future may be looking like for the general public and college campuses?
So, yeah, so I think we all kind of go through this doom scrolling, right? Especially recently, and a lot of the COVID news, unfortunately, has been bad. Numbers are getting bad. We just went over 400,000 deaths, especially in the U.S. Seems like we're not through the worst of it. Hospitalizations are really bad, but it actually hides some optimism. I'm actually optimistic. I can't predict the future, and things can change, but I really think, I mean, the news around vaccines is just amazing. I just can't tell you how amazed I am how quickly we came out with such effective and safe vaccines. So, sorry, I keep getting muted. Good. Okay. So that's something that I'm really optimistic about. And yes, the vaccine rollout could be more effective, but I think it's just going to keep getting better and better. As more people get vaccinated and as the weather turns, I think the numbers are going to go down. And I think by fall we may. I bet money on most of us all being back on campus again to something that resembles a new normal. I'm not going to say normal because I don't think anything can ever be normal again. But I think we will have students in class and in-person classes by next fall. Let's see how well the vaccination campaigns go. But I think, I think that's going to happen by fall. Will there be travel this summer? I mean, I planned on going on a motorcycle trip to Canada, but things are a little bit on hold for the summer. But I think fall things will be much better. So I'm really optimistic about it. And I think, again, the news around vaccines, I know a lot of people are really nervous about it. The news should be, oh my gosh, we developed a vaccine for a disease that we didn't even know existed in less than a year. And it's safe and it's incredibly effective. I think that's something that we need to really, be proud of. The other thing I think I'm really optimistic about is I think, there are folks who are, they don't believe they don't believe in the disease. They think it's the flu, et cetera, et cetera. But you know what? I also see another side. I see a community really coming together. I really do. I think those folks who take this seriously, who are looking out for each other, and really trying to make their communities better. So I see that as optimistic. I know we focus on a lot of the anti-maskers and people who deny the science, but I think there's another side to that. So call me an optimist. I'm an optimist. Do you want me to answer the other question?
Yeah, I was going to ask you right now. So the next question for you, Han, and then we'll have one for Anisa and Asma. So this next question for Han, what are some barriers you face when visiting Southeast Asia coming from the US? And how do you ensure you respect the locals and the culture? I love Thailand and visiting there and planning going back. So I'd love to know your practices of not being quote unquote touristy.
Yeah, so there's being a tourist and there's being a traveler, right? And I think that's an important distinction. And we want to be travelers. I think, this concept of global citizenship is really important. And, it's kind of, I think there's a lot of negative perception about that. They talk about globalism as a bad thing. I don't particularly think it is. I think it is a good thing. I think we have citizenship rights and responsibilities at multiple levels. So we're citizens of Salt Lake City, we're citizens of Utah, we're citizens of the US. But I really think that being a citizen of the world is also important, a global citizen. And that has specific rights and, more importantly, responsibilities as well. So I think that's a really important concept. Now, I could talk about this for hours, but I think the one thing to know when you travel to somewhere like South, or travel to anywhere, if you travel down to Provo, well, okay, not Provo maybe, but wherever you travel to, I think the most important thing to bring is humility. You are there to learn. You're not there to get selfies, to post stuff on Instagram. You're not there to teach people the better way, your way of doing things. You're there to learn. And if you have that attitude, that's going to benefit everybody. Yeah, you're going to come back a wiser, stronger person, but also you're going to be teaching folks. You're going to be making connections, and you're going. Yeah, I think that's the most important thing. Travel is about relationships, about meeting people. It's really not about the place. It's about the relationships with different people around the world. And I think going in there with a sense of humility is how you create connections, how you create relationships.
All right, thanks, Don. So a question for Asma and Anisa. What would you say is the best part of the program or your favorite part of the public health program at Westminster College?
Perfect. So for me, the best part of being a Westminster student in general is the small class sizes. I feel like that really affords you the personal relationship with each of your instructors. And so I feel like all of the instructors I had with the public health program all known what I wanted to do and helped aided me in accomplishing my goals and taking that next step. So one thing that I wanted to mention is that I am also a contact tracer for the Tooele County Health Department. And the way that I got this position was because of one of my mentors and professors who is actually the director of the master's program. His name is Dr. John Contreras. And I feel like having this relationship with him afforded me with this opportunity in becoming a contact tracer. Another really big thing that I really love about this program is all of the topics that we discuss, from whether that be global health to infectious and chronic diseases to social and behavioral science to epidemiology. We cover a big umbrella of different topics within the public health field. And I feel like that is also a really big thing for me, and it really aided in my education here at Westminster.
For me, I think my favorite part of this program, and I think is very unique, is the professors really creating a safe space for all of their students. And I think being in a predominantly white institution and white state, me and Anisa felt that we had to silence ourselves to fit in or morph to what society deems us to be, so that way we don't align with any stereotypes and things like that. And so I think that with the public health program here, the professors really try to make a safe space for people to talk about their lived experiences, to really understand different social determinants of health and how that affects communities of color and marginalized communities, and also allow students who don't identify with marginalized identities and really want to understand. No one really points that out, right? Like, it's a safe space for everyone, and no question is a dumb question, right? And I think that being a student of color with a lot of different experiences, I was able to contribute to conversations in classes and discussions that I don't think other students in other institutions will have the opportunity to. And like I said, my older sisters, they went to the U and they often felt alienated in their classrooms, whereas me and Anisa, I always felt welcome, felt comfortable to contribute. Even being here today with you all is a really big privilege. And alongside with that, I think that just being a public health student allows us to understand the climate of the world and the importance of the pandemic and going into this field. Me and Anisa got our second doses of the vaccine. I got mine today. She got hers last week. So we're fully vaccinated and really bringing that health education into our communities, which often tends to be anti-vaxxers, honestly. Like our Somali community here, they really don't like vaccines, and really bridging that gap with them and at a level that they understand, speaking Somali with them, telling them why we decided to get the vaccine and things like that. And I think Colette was talking about her class and how she really teaches her students to really understand the different health behaviors of communities. And I think that allowed us to really understand our community and how there was a barrier built up for so long and how to diminish that and use what we learned in school, but also our experiences as women of color to really bridge that gap and lead our communities to a healthier future.
All right, great. And glad you got vaccinated too. That's exciting that you got both doses. Another question in the chat: if you could give one piece of advice when applying to college or Westminster, what would it be? And do you need to know what you want to major in before you go into college? What would you say, Asma and Anisa?
I would say one piece of advice that I would give is not to hold yourself back. If you're passionate about something, if you're dedicated towards something, just go for it. The world is your limit. And I would say that one thing is that you don't necessarily need to know what your major is going into college. That's what generals are for in that first year. Like Asma said, we were neuroscience before until we switched to public health. I would say just communicate with people in both or in various majors that you think you want to go into, and have that open dialogue with them to officially know that where your passions align. And you don't necessarily need to make that decision until sophomore year. Junior year is like pushing it, but you can always make it through.
Yeah, and I think the beauty of Westminster is being able to either double major, custom major. I know a lot of institutions don't allow you to really customize your major, having minors and things like that. So if you have different passions, you can pursue all of them, right? Mm-hmm. And I think that faculty and staff does a really good job at really advising you and really tailoring your education to what you want to do in the future. A piece of advice that I would tell myself going back is to not have any imposter syndrome. It's very daunting going into college, especially when you're first gen. And I think that oftentimes we don't have that representation or that figure to really look up to, especially for us going to an institution that none of my sisters went to before. It was very unique for us to really stray away from the norm of our family and go to Westminster. But I think that no matter what you're thinking, even if it's self-doubt or self-hate or negative self-talk, just try to reaffirm yourself because there is a space for you here at Westminster, and you'll be welcomed and you'll be fully supported. And like Han was saying, or was it Colette, that peers really get to know each other. Like in the classroom, you really learn your peers. You built a really good relationship with them, and I think some of our best friends were in our classes or in our cohort, and I think that just make the best of your experience throughout college, and you got this, and we're your biggest cheerleaders.
All right, thank you. We don't have any other questions in the chat, but Han and I have both posted our emails in the chat. Asma and Anisa, if you could post yours too in the chat, that would be great. And then Harrison also posted his email in the chat. If you have any questions about general admissions, not specifically related to public health, you can reach out to Harrison for that. Otherwise, one other thing I guess I can touch on really quickly is about our capstone experience. Our capstone experience at Westminster is really unique in that you have the opportunity in public health to go through a full research project, and there's not many other institutions where you actually carry out a research project from start to finish in an undergraduate program. So that is a really great experience, and you can pursue a topic of your interest that you are passionate about. So that really is something that's great within the public health program, and we as faculty mentor you throughout that entire process. So maybe to close, if Anisa and Asma, if you want to just quickly give an overview of your capstone experience, that might be helpful to potential students as well.
Yeah, so in our capstone class, you have a choice of being in groups of 2 or 3 or even 1. And for our group, it's both me, Anisa, and a friend of ours named Salma. And we really wanted to tailor our capstone to maternal mortality in the United States. So we're really researching the experiences, the birthing experiences of Black women when it comes to birth.
Yes,
sorry, I'm spacing out.
So, like Asma said, our primary focus with our research project is Black maternal mortality, specifically in Utah. So we're looking at the perceptions of positive birthing experiences, barriers to positive birthing experiences, and relationship with primary care providers here in Utah. We are aiming to research and reach out to about 15 participants who are Black mothers living in Utah. And I would say that our capstone experience was not necessarily easy because it is work, but it was easy in the sense that we had all of the help that we needed. Our advisor is Colette, who is amazing, and she really helped us with getting our IRB approved and the steps that we need to take in order to start the interview process, which will then lead to our completion of our research. And so I would say that our research overall has been a really good and rewarding experience. And it's really good to contribute back into the public health field in this way.
Yeah. And like I said, like, you pick your passion and you roll with it. For us, it was the increasing trends of Black maternal mortality, and we made that into our Capstone project, and we're able to pursue that right to the end of it, and maybe we could even publish our research. And I think that is very unique to really picking what you're passionate about and researching that, and also pick who your team members are and also your mentor for the project. And I think that's very unique to Westminster, and it just ensures and guarantees your success, because then you'll be motivated to do the work that you want to do, right? Rather than being in a project that was picked for you.
All right, that's great. Thank you. You two are amazing. That is it for questions. Like I mentioned, if you have any questions for us, we all have our emails in the chat, so feel free to reach out at any time and we'll get back to you. And thank you all for coming. Hopefully we gave you a lot of good information about the program and about public health. And yeah, we hope to see you soon. We hope you end up coming to Westminster and coming into public health. Thank you, everyone.
Thank you, everyone.
Bye, everyone.